Hi guys, this is John Adams, I'm the Rehab Documentation Guru, and I am reporting and recording in Bradley International Airport outside of Hartford, Connecticut. Just got done doing documentation boot camp, and one of the things that came out this weekend from presentation was some people asked me to perhaps do a template or a video related to hard conversations with people that are pushing you to give more therapy than you know is medically necessary. So I decided to do that. And so anyway, if you hear an overhead speaker once in a while, that's because they're making announcements. But I didn't want to forget to do this, and so I laid out what I teach in my class. By the way, if you have not been to my course Documentation Bootcamp, some of the things I say today may not be readily apparent to you. And so going to that course will enhance this, what I'm about to say. But if you've been to my course, all of this you've either heard before or it makes sense. So first of all, sometimes we are requested by individuals to deliver more than what is medically necessary for rehabilitation. We know it's time to discharge, but we're getting pushback. Not every conversation you have with an individual who's pushing you to give more therapy than you know is necessary is going to go well. And we know that, and we've had those experiences. Some of those conversations might be with doctors, some might be with patients and or family, some might be with administrators who are pushing for more bucks than what you believe is necessary. So there are times when it's not going to go well. With that said, though, I'm going to give you a format for a conversation that is consistent with what I teach in Documentation Bootcamp that should help you mitigate any bad feelings that are occurring or any sense whatsoever on the part of the other individual that you have shortchanged the patient in some way. One thing to remember is that you are always responsible to the third-party payers, to your licensure, to ethical standards, to the patient for the care that you give. And so we can't give excessive care. We have to give what the patient needs and then no more. So since there is going to be cases where you're going to have difficult conversations, I'm going to go ahead and give you a format for that conversation. The beginning of the conversation will probably reference how the patient came to you in the first place. So it could start off with, the patient was referred to me for, and this is always going to be related to diagnoses and the functional deficits. And again, if you've been to my course, this will make sense. So you're going to start off the conversation that way. This is why the patient came to me, and tie it into the functional stuff that you are addressing in your plan of care. Next, you go on to say, I evaluated them and found them to have the following underlying impairments. Those are the causes of the functional deficit, and that's a demonstration of your knowledge and skill to find those things out. So then you go on to say what you did about it. And if you've been in my course, you've learned about ICE and appropriate care planning, and so this is how I'd formulate that conversation, this part of it. I improved these impairments. I taught the patient to compensate for these impairments that were no longer improving. And I impacted the necessary environmental adaptations to safely and effectively turn them over to the next level of care, including. And then given those details that fulfill all components of the ICE model of care, which is a comprehensive rehab model, excluding only maintenance therapy. So then you go on to say, at this time, I have exhausted my scope of practice. And finally, there is no longer existing any medical necessity to continue services. And on this video, that word services may be excluded because of my little thumbnail picture here. But there no longer exists any medical necessity to continue at this point. And that's the basic gist of the conversation that you'll have with them. But let's face it, no matter how cogent your argument is, no matter how well-versed you are in that kind of strategy for talking to them, you may still sometimes get occasional pushback from people that are not valuing your opinion on the matter and pushing back to give patients more service. So may I suggest the following continuation of the conversation if you get continued pushback. I understand that you are concerned about the welfare of the patient. Now that may or may not be true. It may be somebody's purely thinking finances here, but always couch it in a clinical mindset. So I understand that you're concerned about the welfare of the patient. Perhaps you have noted an underlying impairment in your assessment of the patient's functional deficits that I have missed. So I'm not accusing them of picking out something that's false. I'm going to acknowledge that maybe they did pick out something. And lo and behold, there may be instances where we miss something, they bring up something, and we go, you know what, that's a really good idea. But if you know that's not the case, this conversation should go better, even better than what I previously talked about. So anyway, perhaps you've noted an underlying impairment in your assessment of the patient's functional deficits that I have missed. And then finally, I would say, could you tell me what your assessment reveals about the remaining underlying impairments that could be improved upon, compensated for, or require further environmental adaptation? And folks, if at that point, the person that's pushing you to give more therapy than you know is necessary continues to push, and this is somebody that's in a supervisory role over you, may I suggest one thing? Find a new job. Because that person is not wanting ethical standards of practice. They want you to do that which is unethical. And so anyway, I hope this has been helpful. Again, this is John Adamson, the Rehab Documentation Guru. If you've liked this video, please give a thumbs up and subscribe to my channel and tell your friends who are therapists about it too. I will continue to post relevant content to documentation and helping support you, not only keep your patients on caseload, but give them the best possible care and get paid for what you do. Take care. Bye-bye.